Hello and welcome to the Department of Medical Assistance Services recorded webinar for the High Needs Housing and Employment Supports Program Update. The objective of today's meeting is to provide policy details on the High Needs Supports Program, as well as provide an update on upcoming opportunities for public comment. Status of policy and operational design for the High Needs Support Program. DMAS has developed a High Needs Support policy paper through multiple working sessions and iterating with internal stakeholders. Interviews with and comprehensive reviews of best practices from other states with similar supportive housing and/or employment benefits authorized under 1115 waivers. In addition, we've negotiated and iterated with the federal government. The program design decisions memorialized in the HNS policy paper reflect the agreed upon special terms and conditions negotiated with the Centers for Medicare and Medicaid Services, as well as input from state agency partners. DMAS will continue to seek stakeholder input to further guide the operational and implementation design of the High Needs Support Program. The HNS policy paper has been posted for your review on the DMAS website. Stakeholder engagement and public comment period. Beginning on September 4th, the HNS policy paper will be available on the DMAS website. In addition, a registration link will be made available for the upcoming HNS virtual town hall. October 14th is the date of the HNS virtual town hall that will be held via live WebEx with a forum for making formal public comment on the program design. This also kicks off the 30-day public comment period for the program. Additional information is available to the link listed here for the town hall's general notice. In addition, there are other dates to be determined for stakeholder work groups that will be held based on the received public comments. Please regularly check the DMAS website for meeting dates and registration links. Checking the DMAS website for implementation updates. On the DMAS homepage, on the left-hand side, under Programs and Services, is the area to click for the High Needs Support Program, where all the information you will need will be listed on an ongoing basis. HNS Program Overview. The implementation of the High Needs Support Program is scheduled for July 1st, 2022. Delivery system. The target population will be Medicaid enrollees age 18 and older enrolled in the managed care delivery system, including those with a behavioral health need, those with a need for assistance with activities of daily living, or individuals with complex physical health needs. To ensure that there is no duplication of federal funding, DMAS will be limiting the HNS benefit to individuals who are not receiving services through a developmental disability waiver. Being on a 1915C DD waiver waitlist, however, will still allow access to receive housing and employment support services. Administration. The managed care organizations who administer the Commonwealth Coordinated Care Plus CCC Plus program will administer the High Needs Support benefit with DMAS overseeing the program. CCC Plus is an integrated delivery model that includes medical services, behavioral health services, and long-term services and supports. CCC Plus includes care coordination and utilizes person-centered care with an interdisciplinary team approach. High Needs Support Program Administration. The CCC Plus MCOs will administer the High Needs Support benefit with DMAS overseeing the program. This shows a graphic outlining the key roles and responsibilities by each entity involved with the program. Virginia DMAS. Accountable for High Needs Support Program operations, oversight, implementation, monitoring, and evaluation to ensure program integrity, as well as compliance with federal and state requirements and Medicaid managed care contractual obligations. Contract and pay CCC Plus managed care organizations for providing approved high-need support services and related activities. MCOs will facilitate the launch of and administer the high-need support program at the plan level, consistent with DMAS requirements. They will identify and screen potentially eligible members and manage referrals. They will oversee MCO care coordinators who are providing care management. They will contract and pay claims for providers of housing and employment supports who deliver services to high-need supports enrollees. MCO care coordinators. They will coordinate care for high-need support enrollees, including managing their physical, behavioral, and non-medical care needs. They will assess and reassess the needs of enrollees determined eligible. They develop and maintain person-centered care plans. High-need supports provider entities and staff. They deliver housing and employment support services to the enrollees. They comply with provider requirements as determined by federal regulations, CCC Plus contract requirements, and provider agreements. The high-need support eligibility. The high-need support benefit targets Medicaid enrollees aged 18 or older enrolled in the managed care delivery system. Individuals must meet at least one needs-based criteria, as well as either housing risk factors or an employment risk factor. The needs-based criteria includes individuals with a behavioral health need, those in need for assistance with activities of daily living, as well as complex physical health needs. The housing risk factors include at risk of homelessness, history of frequent or lengthy stays in an institutional setting, assisted living facility, or residential setting, history of frequent emergency department visits and or hospitalizations, history of involvement with the criminal justice system, and history of frequent moves or housing loss due to behavioral health symptoms. The employment risk factors include unable to be employed for at least 90 consecutive days due to mental or physical impairment, unable to obtain or maintain employment resulting from age, disability, or brain injury, more than one instance of inpatient or outpatient SUD service in the past 2 years, or at risk of deterioration of mental illness and or SUD. In addition, the individual would be expected to benefit from housing and or employment supports. High-need support services. The high-need support services will allow individuals to secure and maintain housing and employment, thereby meaningfully impacting health outcomes. Examples of housing support services include individual housing and pre-tenancy services, individual housing and tenancy sustaining services, as well as community transition services. Example of employment services include pre-employment services and employment sustaining services. DMAS developed the approved services through multiple working sessions, conducting an assessment of Virginia's Medicaid enrollees' needs, reviewing best practice models in other states, and iterating with stakeholders and CMS. More detailed information on the approved services is available on DMAS's website on the High Need Support Program page that was previously referenced. High Need Support's Provider Network. DMAS will require MCOs to contract with a network of housing and employment supports provider entities by leveraging existing providers in the community that are experienced and qualified to address the health-related needs of the population. Provider entities will also be enrolled with Medicaid and credentialed with the MCOs. While some of these providers already contract with Medicaid, the majority have limited exposure to Medicaid managed care and will require initial and ongoing support from DMAS and the MCOs. HNS provider staff qualifications include minimum education, experience, and skills requirements. High Need Support Implementation Timeline. In calendar year 2020, DMAS received CMS approval of the High Need Support Special Terms and Conditions. It also finalized the Operational Design and Implementation Planning Policy Paper called the HNS Policy Paper. In addition, there are bi-monthly stakeholder engagement meetings. For calendar year 2021, DMAS will be developing IT functional specifications, engaging in provider network development, having member engagement, stakeholder engagement, and working on system changes. In calendar year 2022, there will be provider network development and systems changes, all in preparation for the July 1st, 2022 go-live date for the High Need Support Program. DMAS contacts. Stakeholder feedback can be submitted to the HNS program email inbox, which is hnsprogram@dmas.virginia.gov. If you have housing questions, please email Elizabeth Seward at elizabeth.seward@dmas.virginia.gov. For employment questions, please email Erin Wagner at erin.wagner@dmas.virginia.gov. Thank you, and we look forward to receiving input and working with all of our stakeholders and partners as we build this critical program for Virginians. Thank you.